हेलो एवरीवन, आज हम फंडामेंटल ऑफ नर्सिंग के यूनिट नंबर 4 के MCQs को कंटिन्यू करेंगे। क्वेश्चन नंबर 1, विच ऑफ द फॉलोइंग बेस्ट डिफाइंस पेन? ऑप्शन ए, अ फिजिकल सेंसेशन ओनली। ऑप्शन बी, एन अनप्लेजेंट सेंसरी एंड इमोशनल एक्सपीरियंस। ऑप्शन सी, अ मेंटल परसेप्शन विदाउट एनी फिजिकल बेसिस। ऑप्शन डी, अ फिजियोलॉजिकल रिफ्लेक्स। Correct answer is option B, an unpleasant sensory and emotional experience. Question number 2, the nurse recognized pain as which of the following? Option A, always visible and measurable. Option B, subjective experience. Option C, objective data. Option D, easily verified by observation. Correct answer is option B, subjective experience. Question number 3, which of the following best describes somatic pain? Option A, arises from internal organs. Option B, arises from skin, muscles or bones. Option C, caused by nerve damage. Option D, pain that radiates from another site. Correct answer is option B, arises from skin, muscles or bones. Question number 4, which type of pain results from skin damage such as burns or cuts? Option A, deep somatic pain. Option B, superficial somatic pain. Option C, neuropathic pain. Option D, visceral pain. Correct answer is option B, superficial somatic pain. Question number 5, which type of pain originates from internal organs? Option A, somatic pain. Option B, visceral pain. Option C, neuropathic pain. Option D, referred pain. Correct answer is option B, visceral pain. Question number 6, chronic pain is defined as pain lasting for. Option A, less than 1 week. Option B, 1 to 2 months. Option C, more than 3 months. Option D, more than 1 year. Correct answer is option C, more than 3 months. Question number 7, acute pain is usually associated with. Option A, depression. Option B, healing and tissue damage. Option C, insomnia. Option D, no physiological response. Correct answer is option B, healing and tissue damage. Question number 8, referred pain is. Option A, pain localized to the site of injury. Option B, pain felt in an area distant from its source. Option C, pain limited to the skin surface. Option D, imaginary pain. Correct answer is option B, pain felt in an area distant from its source. Question number 9, a patient experiences shoulder pain during gallbladder disease. This is option A, somatic pain. Option B, referred nociceptive pain. Option C, neuropathic pain. Option D, functional pain. Correct answer is option B, referred nociceptive pain. Question number 10, neuropathic pain is caused by. Option A, inflammation. Option B, nerve injury or dysfunction. Option C, muscle strain. Option D, organ distension. Correct answer is option B, nerve injury or dysfunction. Question number 11, phantom limb pain occur in. Option A, organ transplant recipients. Option B, amputees. Option C, patient with fractures. Option D, paralysis cases. Correct answer is option B, amputees. Phantom limb pain is a perception of pain in a limb that is no longer there after an amputation. It is a real and often distressing sensation that can feel like burning, stabbing, tingling, electric shock. The pain is thought to result from the brain and nervous system trying to adjust to the loss of limb. Question number 12, cancer pain is typically. Option A, only acute. Option B, only neuropathic. Option C, a combination of acute and chronic pain. Option D, absent in advanced stages. Correct answer is option C, a combination of acute and chronic pain. Question number 13, psychogenic pain refers to. Option A, imaginary pain. Option B, pain caused by mental or emotional factors. Option C, pain due to infection. Option D, no real sensation. Correct answer is option B, pain caused by mental or emotional factors. Question number 14, what is nociceptive pain? Option A, pain caused by nerve injury. Option B, pain caused by tissue damage that activates pain receptors. Option C, pain without any physical cause. Option D, psychogenic pain. Correct answer is option B, pain caused by tissue damage that activates pain receptors. Question number 15, nociceptors are. Option A, specialized sensory receptors that detect tissue damage. Option B, glands secreting hormones. Option C, brainstem neurons. Option D, pain suppressors. Correct answer is option A, specialized sensory receptors that detect tissue damage. Question number 16, nociceptive pain can be classified into. Option A, acute and chronic. Option B, somatic and visceral. Option C, local and referred. Option D, central and peripheral. Correct answer is option B, somatic and visceral. Question number 17, a patient complains of sharp pain at a wound site. This is most likely. Option A, neuropathic pain. Option B, somatic nociceptive pain. Option C, referred pain. Option D, functional pain. Correct answer is option B, somatic nociceptive pain. Question number 18, visceral nociceptive pain arises from. Option A, skeletal muscles. Option B, internal organs such as heart, stomach and intestine. Option C, nerves. Option D, ligaments. Correct answer is option B, internal organs such as heart, stomach and intestine. Question number 19. Visceral nociceptive pain is often option A well localized, option B poorly localized and may radiate, option C superficial, option D sharp and shooting. Correct answer is option B poorly localized and may radiate. Question number 20. Recurrent pain is option A short and constant, option B pain that occurs intermittently over time, option C pain after anesthesia, option D pain from trauma only. Correct answer is option B pain that occurs intermittently over time. Question number 21. Pain tolerance means option A point where pain starts, option B maximum level of pain a person is willing to endure, option C minimal pain sensation, option D absence of pain. Correct answer is option B maximum level of pain a person is willing to endure. Question number 22. The pain threshold is option A a point at which pain begins to be perceived, option B maximum pain a person can tolerate, option C level of comfort, option D degree of sedation. Correct answer is option A point at which pain begins to be perceived. Question number 23. The first step in nursing process for pain management is option A evaluation, option B assessment, option C implementation, option D planning. Correct answer is option B assessment. Question number 24. A nurse assessing a patient's pain should always option A rely on physiological indicators only, option B believe the patient's self-report, option C compare with previous patients, option D avoid asking questions. Correct answer is option B believe the patient's self-report. Question number 25. Which nursing intervention is most appropriate for assessing pain intensity? Option A checking vital sign, option B using a standardized pain scale, for example numeric or visual analog scale, option C observing facial expressions, option D monitoring medications intake. Correct answer is option B using a standardized pain scale, for example numeric or visual analog scale. Question number 26. The visual analog scale typically measures pain on a line of option A 0 to 3 cm, option B 0 to 5 cm, option C 0 to 10 cm, option D 0 to 20 cm. Correct answer is option C 0 to 10 cm. Here you can see the picture of visual analog scale, that is 0 to 10 cm. Question number 27. The visual analog scale is best used for option A unconscious patients, option B patients who can mark their pain on a line, option C infants, option D dementia patients. Correct answer is option B patients who can mark their pain on a line. Question number 28. The numeric rating scale asks patient to rate pain on a scale of option A 0 to 5, option B 1 to 5, option C 0 to 10, option D 1 to 10. Correct answer is option C 0 to 10. Question number 29. The McGill Pain Questionnaire evaluates pain based on option A numeric score only, option B physiological responses, option C sensory affective and evaluative descriptors, option D facial expressions. Correct answer is option C sensory affective and evaluative descriptors. Question number 30. The behavioral pain scale is most commonly used in option A ICU and mechanically ventilated patients, option B children's, option C maternity wards, option D outpatient departments. Correct answer is option A ICU and mechanically ventilated patients. Question number 31. During a pain assessment, the nurse uses the mnemonic PQRST. Stand for provocation, quality, region, severity, and time. What does this tool help determine? Option A type of pain medication required, option B the detailed characteristics of the patient's pain, option C the emotional response to pain, option D the duration of hospitalization. Correct answer is option B the detailed characteristics of a patient's pain. Question number 32. The pain scale is most appropriate for children above 3 years. Option A flag pain scale, option B visual analog scale, option C Wong-Baker-Facis scale, option D numerical rating scale. Correct answer is option C Wong-Baker-Facis scale. Question number 33. When assessing pain in a non-verbal or unconscious patient, which indicator is most reliable? Option A patient's facial expression and body movements, option B verbal report from family, option C nurse's assumption based on diagnosis, option D medication schedule. Correct answer is option A patient's facial expression and body movements. Question number 34. When assessing pain in an older adult with cognitive impairment, which tool is most appropriate? Option A Wong-Baker-Facis pain scale, option B McGill pain questionnaire, option C numeric rating scale, option D pain AD scale, pain assessment in advanced dementia. Correct answer is option D pain AD scale, pain assessment in advanced dementia. Question number 35. The pain AD scale evaluates option A facial expression, body movement, mood, option B breathing, vocalization, facial expression, body language, consolability, option C heart rate and BP, option D sleep pattern. Correct answer is option B breathing, vocalization, facial expression, body language and consolability. Question number 36. The flag pain scale is used for option A elderly, option B unconscious adults, option C infant and non-verbal children, option D teenagers. Correct answer is option C infants and non-verbal children. Question number 37. Which hormone increases during pain and stress? Option A insulin, option B cortisol, option C estrogen, option D thyroxine. Correct answer is option B cortisol. Question number 38. The afferent pathway of pain carries impulses. Option A from the brain to the body, option B from receptors to the spinal cord, option C from spinal cord to the muscles, option D from cerebellum to the cortex. Correct answer is option B from receptors to the spinal cord. Question number 39. The thalamus plays a key role in pain by option A blocking all pain signals, option B relaying pain messages to the cerebral cortex, option C reducing inflammation, option D increasing endorphins. Correct answer is option B relaying pain messages to the cerebral cortex. Question number 40. Pain perception occurs in which part of the brain? Option A hypothalamus, option B cerebral cortex, option C medulla oblongata, option D cerebellum. Correct answer is option B cerebral cortex. Question number 41. Pain modulation involves which natural substances? Option A insulin and glucagon, option B endorphins and enkephalins, option C adrenaline and cortisol, option D oxytocin and prolactin. Correct answer is option B endorphins and enkephalins. Question number 42. Endorphins are known as option A natural painkillers, option B pain transmitters, option C muscle relaxants, option D hormones that cause pain. Correct answer is option A natural painkillers. Question 43. A delta fibers are responsible for option A slow dull pain, option B fast sharp well localized pain, option C no pain transmission, option D temperature regulation. Correct answer is option B fast sharp well localized pain. Question number 44. C fibers transmits option A fast localized pain, option B slow burning or aching pain, option C cold sensations only, option D reflex actions. Correct answer is option B slow burning or aching pain. Question number 45. The neurotransmitter released by nociceptors is option A serotonin, option B substance P, option C acetylcholine, option D dopamine. Correct answer is option B substance P. Substance P is an 11 amino acid long neuropeptide expressed by the central nervous system and the peripheral nervous system and immune cells. Question number 46. The term analgesia refers to option A complete loss of consciousness, option B relief from pain without loss of consciousness, option C loss of sensation and consciousness, option D numbness in local areas. Correct answer is option B relief from pain without loss of consciousness. Question number 47. Opioid analgesics are most effective for option A neuropathic pain, option B nociceptive pain, option C psychogenic pain, option D all equally. Correct answer is option B nociceptive pain. Question 48. Which route is most effective for opioid administration in severe pain? Option A oral, option B rectal, option C intravenous, option D topical. Correct answer is option C intravenous. Question number 49. Which is the major side effect of opioid analgesics? Option A diarrhea, option B hypotension, option C constipation and respiratory depression, option D hypertension. Correct answer is option C constipation and respiratory depression. Question number 50. Which nursing action prevents opioid-induced constipation? Option A increasing fluid and fiber intake, option B reducing food intake, option C restricting fluids, option D giving antiemetics only. Correct answer is option A increasing fluid and fiber intake. Question number 51. Which nursing intervention should be performed before administering an opioid analgesic? Option A record urine output, option B assess the patient's respiratory rate, option C provide a cold compress, option D offer oral fluid. The correct answer is option B. Assess the patient's respiratory rate. Question number 52. Which adjuvant drug is used for neuropathic pain? Option A antibiotic, option B antidepressant or anticonvulsant, option C antihypertensive, option D anticoagulant. Correct answer is option B antidepressant or anticonvulsant. Question number 53. The nurse evaluates pain relief after analgesic administration by option A asking the family, option B observing patients body language and verbal report, option C checking lab reports, option D assuming effectiveness. Correct answer is option B observing patients body language and verbal report. Question number 54. Pain assessment after giving medication should occur within option A 15 to 30 minutes for IV and 1 hour for oral. Option B 5 minutes for all routes. Option C 3 hours for oral. Option D 2 hours for IV. Correct answer is option A 15 to 30 minutes for IV and 1 hour for oral. Question number 55. In older adults, pain assessment may be challenging because option A they exaggerate pain. Option B they may underreport due to fear of treatment. Option C they have higher pain tolerance. Option D they always use scales correctly. Correct answer is option B they may underreport due to fear of treatment. Question number 56. A nurse documents patient state pain decreased from 8 to 3 after medication. This represents which stage? Option A assessment. Option B planning. Option C implementation. Option D evaluation. Correct answer is option D evaluation. Question number 57. When using a patient controlled analgesia pump, the nurse should option A allow family to press the button. Option B educate the patient to self-administer. Option C set high continuous infusion rate. Option D leave setting unlocked. Correct answer is option B educate the patient to self-administer. Patient controlled analgesia PCA is a type of pain management that lets you to decide when you will get a dose of pain medicine. A method of pain relief in which the patient controls the amount of pain medicine that is used. When pain relief is needed, the person can receive a preset dose of pain medicine by pressing a button on a computerized pump that is connected to a small tube in the body. Here you can see patient control analgesia pump with the button in patient's hand. Question 58. What is the primary mechanism of action of NSAIDs? Option A inhibition of prostaglandin synthesis. Option B activation of opioid receptors. Option C blockage of histamine receptors. Option D inhibition of dopamine release. Correct answer is option A inhibition of prostaglandin synthesis. Prostaglandins are natural and powerful substances that affect several aspects of your body. While prostaglandins are necessary for bodily process such as healing, having excess prostaglandins can cause chronic pain and inflammation. Question 59. What is the most common adverse effect of long-term NSAIDs use? Option A constipation. Option B gastric ulceration. Option C hyper. Option D weight loss. Correct answer is option B gastric ulceration. Question number 60. Aspirin irreversibly inhibits which enzyme? Option A COX-1 only. Option B COX-2 only. Option C both COX-1 and COX-2. Option D lipooxygenase. Correct answer is option C both COX-1 and COX-2. Prostaglandins formed by the enzymatic activity of COX-1 are primarily involved in the regulation of homeostatic functions throughout the body, whereas prostaglandins formed by the COX-2 primarily mediate pain and inflammation. Question number 61. Which NSAID is safest for patients with gastric ulcers? Option A ketorolac. Option B endomethacin. Option C celecoxib. Option D aspirin. Correct answer is option C celecoxib. Question number 62. What is the major renal side effect of NSAIDs? Option A nephrotic syndrome. Option B acute renal failure due to decreased renal blood flow. Option C renal calculi. Option D glomerulonephritis. Correct answer is option B acute renal failure due to decreased renal blood flow. Question number 63. Which of the following is both analgesic and antipyretic but weak anti-inflammatory? Option A paracetamol, acetaminophen. Option B diclofenac. Option C naproxen. Option D indomethacin. Correct answer is option A paracetamol, acetaminophen. Question number 64. Which NSAID is commonly used in postoperative pain management but limited to short-term use? Option A ketorolac. Option B naproxen. Option C ibuprofen. Option D aspirin. Correct answer is option A ketorolac. Question number 65. Which NSAID has the shortest half-life? Option A ibuprofen. Option B piroxicam. Option C naproxen. Option C meloxicam. Correct answer is option A ibuprofen. Question number 66. Which of the following NSAID is contraindicated in children due to Reye syndrome? Option A aspirin. Option B naproxen. Option C ibuprofen. Option D diclofenac. Correct answer is option A aspirin. Question number 67. The ceiling effect is associated with option A opioids. Option B NSAIDs. Option C adjuvant drug. Option C local anesthetics. Correct answer is option B NSAIDs. Ceiling effect is known as a phenomenon in which a drug reaches a maximum effect so that increasing the dosage doesn't increase its effectiveness. Question number 68. A patient receiving opioid analgesics for chronic pain reports increased pain despite medication. What should the nurse suspect first? Option A, drug allergy. Option B, psychological pain. Option C, tolerance to the medication. Option D, withdrawal symptom. Correct answer is option C, tolerance to the medication. Question number 69. Which non-pharmacological therapy uses electrical stimulation to relieve pain? Option A, acupressure. Option B, TENS, transcutaneous electrical nerve stimulation. Option C, hypnosis. Option D, biofeedback. Correct answer is option B, TENS, transcutaneous electrical nerve stimulation. Question number 70. Which non-pharmacological therapy is effective for nociceptive pain? Option A, TENS. Option B, acupuncture. Option C, heat and cold application. Option D, all of above. Correct answer is option D, all of above. Thanks for watching. Subscribe for more videos.